In this review of liver cancer screening, we focus mainly on practice and its extended questions. Screening for liver cancer in China started in early 1970s with the application of alpha-fetoprotein, that is AFP, in high-incidence regions. During this period, a sensitive AFP test was used to detect more than 2 million person times in the general population from Qidong, the rural area in China. More than 1,000 cases of liver cancer confirmed by screening, of which early cases accounted for 35%, which has resulted in the improvement of the overall survival rate and won the attention of international colleagues. Screening in the general population was halted in the 1980s in China, simply because the benefit of screening in general population was questioned. The role of AFP screening was re-evaluated. We realized that the economic benefits of screening through AFP detection are determined by the preferred choice of the target population at high risk. Hence, men aged 30 to 59 who were positive for HBsAg were identified as a high-risk population of liver cancer for screening. The implementation of screening for liver cancer has resulted in early detection and has the early curable treatment for patients who have gained short or long-term survival and even have reduced the mortality rates. Although these outcomes are more anecdotal than rigorously evidence-based. AFP or ultrasound examination has been considered as sensitive and specific methods for early detection, but are with limitations. The combined use of these two modalities for screening populations at risk every 6 months seems to have been reached consensus. It has now been extended to nationwide areas, emerging from the concepts of conducting screening in populations at risk with positive HBsAg to the practice programs in rural and urban areas, and finally to the development of recommendations to guide medical practice for healthcare providers. In recent years, the screening methods, such as the combined use of AFP and ultrasound for liver cancer screening, in the view of its relative cost-effective or applicability in community population-based screening, are recommended, and the time interval of semi-annual screening has become consistent and reached a point of consensus. The feasibility of screening for liver cancer is still debated because of differing opinions and even opposition to the choice of target subpopulations. The intrinsic necessity and the contributions of the main risk factors among Western countries and China Asia allies. Yet, the over 51% of global burden of liver cancer is in China. The solution to the early detection and treatment of liver cancer should fully consider the actual situation in China. The effectiveness of screening for liver cancer is worth anticipation. Thanks for your attention.